The royals had been hit by an unprecedented health crisis as 3 members of the family announced serious medical issues within less than a week of each other. Kensington Palace revealed that the Princess of Wales had undergone major abdominal surgery at the London clinic, and just 90 minutes later, Buckingham Palace announced that the King required treatment for an enlarged prostate. Charles, who turned 75 in November, is undergoing a corrective surgical procedure in hospital and has cancelled all his public engagements for several weeks in the meantime. Kate, on the other hand, will be out of action until after Easter as she recovers from what is understood to be a planned abdominal surgery for a condition that we've been told is not cancerous. The Duchess of York then announced a few days later that she has recently been treated for an aggressive form of skin cancer, just 6 months after she was diagnosed with breast cancer and had a single mastectomy and breast reconstruction surgery. The series of health revelations from the family gives an extraordinary glimpse into their private lives, at a level which has not been seen before with regards to health matters, which they previously would not have been so open about. It's a testament to the modernity and transparency of the Carolean era that the monarch feels he wants to share details about a condition that's been largely stigmatized because of its potentially embarrassing symptoms. But Kate and Charles's unprecedented double health scare also raises immediate concerns about the royal family's day-to-day workload, as it means that some of its most senior members will be out of action for some time.
How's His Majesty?
He's fine, thank you very much.
Looking
forward to getting back to work.
Absolutely, thank you very much.
The announcement about Kate's surgery and the long recovery time that now follows came as a shock to all but her closest confidants, as a series of planned engagements and foreign tours were hastily postponed. Kensington Palace informed the world that she would be remaining in a private London hospital to recover for up to 2 weeks and then would return home to Windsor to continue her recuperation. A statement said that her surgery had been successful, but that based on current medical advice, she is unlikely to return to public duties until April. Royal sources said that William was committed to caring for her and their 3 children during this time, and as such had to also cancel a number of his engagements. This decision is another nod to a more modern royal family, with the heir to the throne trying to be a hands-on parent in a family historically not known for putting family ahead of duty. On the one hand, people will think it's laudable that he is being hands-on in supporting his wife and children at this time. But on the other, he is facing some criticism for putting his public duties on the back burner after a year where the number of his engagements again lagged behind other senior royals. While it hasn't been divulged what exactly Kate's major abdominal surgery was for, apart from not being cancerous, the long recovery period sparked immediate speculation about its severity. Previously, we know she has been hospitalized during her pregnancies because of severe morning sickness, known as hyperemesis gravidarum, but has otherwise experienced good health and is visibly fit and sporty. We know that she was not rushed to hospital, and royal sources insisted that her admission was not the result of a sudden development. But as recently as a few days beforehand, her aides had been planning engagements and appeared to expect the forthcoming tours to go ahead. In the palace statement, the princess was said to appreciate the level of interest that the announcement of her surgery would generate, but expressed her hope that the public would understand her desire for her personal medical information to remain private, and for as much normality as possible for George, Charlotte and Louis. For now, we know that the couple's upcoming short-planned tours to Latvia and Italy have been postponed, and that the princess will miss the BAFTA ceremony in February, as well as some day-to-day engagements. Kensington Palace did not rule out Kate choosing to speak publicly about her major surgery in the future, so it may not be the last we hear of it, but in the meantime, palace sources insisted that she is doing well. At the same time, King Charles has been diagnosed with an enlarged prostate after attending a checkup because of symptoms linked to his condition. In an extremely unusual move for the royals, he was understood to be very keen to share the private medical diagnosis with the world in an attempt to encourage others in his position to get checked out. His tactic worked, and the NHS said that there had been an enormous 1,000% increase in searches about an enlarged prostate on their website since his revelation. King Charles is undergoing corrective surgery for his benign condition, with an overnight stay in hospital expected. His public engagements will therefore be postponed for a short period of recuperation, thought to be at least 3 to 4 weeks. The workaholic king, though he has reportedly been urged by his wife to slow things down, has no intention to change his busy schedule upon his recovery and will be keen to be back up and running as soon as he possibly can be. The Princess Royal will be the first in line to stand in if her brother needs downtime and is a reliably popular choice for the bread and butter engagements that typically pack a royal diary. The Duke and Duchess of Edinburgh, too, will continue to keep up their steady schedule of public duties that they quietly get on with. However, that the Princess of Wales is to be out of action until Easter will undoubtedly leave an unexpected vacuum for the modern royal family, who have gradually come to rely on her and her star power a great deal. The fact that William and Kate have carved a unique space in the royal landscape by focusing on their passion projects rather than only attending routine engagements means that her months-long absence will not see anyone else stepping in to fill her shoes in her beloved early years sector. The princess's projects are designed around her own expertise and convening power, and her long-planned engagements about early years can therefore only really be done by herself. Royal sources have insisted that the work on her mission to change life for the next generation can be continued in the background while she is out of the office, and she is understood to be wanting to actively follow updates from home. But with 3 senior royals currently out of action, including Charles, William and Kate, it is left to the Queen, Princess Anne and the Duke and Duchess of Edinburgh to fly the flag for the family and face the prospect of an enhanced workload in the short term. The dual hospital admissions, as well as Fergie's second cancer diagnosis in a year, has for now brought the family's mortality back into the spotlight after the late Queen Elizabeth's death, and hopes of a smooth sailing 2024 following the tumult of the previous few years may have already been dashed. But if anything, the health scares are revealing to the public a more transparent, modern and family-facing monarchy under the new king.